I'm pleased to look into the audience and see some familiar faces who attended the first international symposium. I'm equally pleased to have a chance to see new faces, as the problem of drugs and driving is complex, as we've just heard, and it really does involve a number of different groups. There is no one approach to resolving this issue. There is so many different perspectives, and we really do need some collective action, not only in one's country, but globally, from various groups and various levels, to achieve the collective impact we're all trying to achieve as we try to address this area. Let me tell you a bit about who CCSA is, or the Canadian Centre on Substance Abuse, but I'm going to refer to it as CCSA. We were set up by an act of parliament over 25 years ago, and we're really there as the voice in terms of substance abuse and addictions in Canada. And we really do provide that national leadership to try to find solutions for various things that affect substance use, abuse, and all aspects of it. We really are there to try to find out what those solutions are, what the knowledge is out there, and everything we do has to be grounded in evidence. We believe, I begin with a bit of some of our own beliefs, and we believe that substance abuse is a health issue. And it's a health issue that requires the same level of treatment as any other health issue. What that means is people who are suffering from substance use disorders deserve timely access to a high quality and effective range of treatment services. And we also believe that by ensuring the availability of these services, that recovery is an attainable reality for many. In practical terms, as I mentioned, for CCSA, it's really giving frontline professionals the tools, the knowledge, the resources that they really need to better serve those that are suffering from substance use disorders. We also believe in giving decision makers the same evidence so that all decisions are based on evidence. The end goal for us is that we have in Canada more effective policies, more effective programs, and more effective practices. So our whole raison d'etre is really about that. So that's where we come from. And as Ross mentioned, we also set a national vision for Canada as to what do we need to do in order to address substance use in our country. And as was mentioned, we have a list of 13 priorities that have been identified by our partners from across Canada, and they do include prescription drugs, they do include alcohol, it includes mental health and addiction, and drugs and driving as well. These are just a few things, but again, looking at all aspects of the problem. I also want to say that our big belief, besides the issue of substance use disorders, our big belief is working with people. Everything CCSA does, and everything I might say today is not what CCSA did. It's really CCSA and the experts in Canada and at times globally that have come together to produce some of those solutions. So any of our products, it's not just about CCSA. They've all been developed with partners and experts in the field. So let me move a bit now that I've said who CCSA is. I'll talk a bit about drugs and driving, but I would like to welcome our senior research and policy experts from CCSA, and they will be speaking a bit more in greater detail, and that's Dr. Doug Biernes and Dr. Amy Porath-Waller, who are with me in Welly. And they will be providing a bit more of some of the things we have done at CCSA. Some of the things we have done is roadside service in one of our provinces, British Columbia. We've done a number of roadside services, surveys, I should say. And the importance of those roadside surveys is that the government, before they put in place legislative changes in terms of dealing with drugs and driving, decided to do a baseline survey of what does it look like on the roads today. And then we were brought back in to do a roadside survey of what does it look like now, 2 years later. And some of the changes that had been put in place did have an impact, and that's good news. And certainly Dr. Doug Biernes can speak more to that if you wanted more information as to some of the things that were put into place in that particular province. We have done a lot on examining fatality data that was mentioned as well. And in 2010, for example, nearly as many drivers died in road crashes after using drugs, about 34%. as those who had been drinking, approximately 39%. We have also been paying a lot of attention to our youth and drivers. And as I mentioned over dinner yesterday, it's not about just the drivers. I'd like to always bring attention. It's also about the passengers. And so even though we talk so much about don't drink and drive, don't do drugs and drive, we also have to talk about the passengers that are getting into the car with someone who has taken drugs. So as much attention needs to be given to the driver as to the passenger. But Doug will speak a bit more about some of our prevalence data and also our prevention programs. We commissioned a report that looked at the effectiveness of prevention programs in deterring youth from driving from the influence under the influence of drugs, and we did that to inform future prevention initiatives. And certainly the results of that report were very good in terms of raising the awareness, changing to some extent the attitude. The verdict is still out in terms of changing the behavior. But again, Doug is here to respond to your questions. We also did a lot of work examining the validity of using the standardized field sobriety test to detect drug impairment among drivers. And as I mentioned, Amy can speak more about that. Also most recently, and we brought it with us, CCSA examined the evidence and the strategies to address impaired driving, including drug per se laws. And currently Canada only has per se limits for alcohol, where it is an offense to operate a vehicle with a certain level of alcohol in your body. In our policy brief on per se laws, as I mentioned, they are here. CCSA has suggested per se limits for drugs that they need to be considered by the various provinces in Canada, recognizing the challenges inherent in agreeing upon limits for each drug. And I had an interesting discussion with someone from the UK on that very issue, so I'm sure I will be approaching him more as to the limits they had set. And also in Canada, when we say drugs, we also include prescription drugs, which are legal, but of course, as we all know, with equal potential for impairment. And as we mentioned, we did host the first one with all the partners that are here today back in 2011. And I would like to maybe go over some of the learnings that came out of that session, just so that we can take some of these learnings. Some of them are the same, but we can take some of those learnings as we approach the next 2 days. Clearly, we came out of it saying we still don't know a whole lot, but there is a lot we do know as well. We do now have some effective strategies in place, and we need to pull all of that together. We definitely, clearly acknowledge that this is not like alcohol and driving. The profile is different. There's a lot of different aspects to it. And so some of our key learnings is we learned that there were no international standards for research and reporting on drug-impaired driving. And as a result, the extent and consistency of data collection and information varied considerably. Second, laws and standards also varied widely, which also pointed to a greater need for collaboration and discussion about what approaches are supported by the evidence. We debated whether drug-impaired driving is, at its core, about road safety, or is it about drug control? And then in each country, we needed to be clear on what we were trying to achieve through our legislative approaches. In other words, what was our purpose behind the legislative changes? We questioned what is a drug, and were we all referring to illicit drugs only? And each country had a different view of that, which was very, very interesting. Third, we discussed various approaches to deterrence, detection, enforcement, adjudication all around the world, and what works best in terms of getting results and impacting behavior. Fourth, we determined that prevention efforts targeting drug use and driving were still generally in their infancy, but there were lessons to be learned from other prevention efforts, not necessarily just in the drug world, but in other areas, whether it be tobacco or safety belts. We learned that there are many target groups that we need to consider when we look at prevention efforts. We can't look at the youth in the same way that we look at the elderly, but yet we do need to look at both. We can't look at the substances all as if they're one homogeneous group, but we have to look at each of those separately. So therefore, our prevention needs to focus on those things. We determined that in really trying to seek a cultural and behavioral change, we needed to do what we did in a number of other areas, and that is make it socially unacceptable to put another person at risk. Not only to put yourself at risk, but to put another person at risk. And we need to make that socially unacceptable and do again what we've done in some other areas. And we've learned that we need to really do a better job at communicating risk associated with drugs and driving. And as you all know, we've done this in other areas, we needed a multi-pronged approach. There was no one approach to this issue. And certainly, as was mentioned, the first symposium highlighted the complexity of the issue just simply in what I've just summarized to all of you. You could see the complexity and the need for greater international cooperation and collaboration as it related to research, as it related to standards, common surveillance systems, and learning from each other in terms of what works. When we left Montreal, we did make a commitment to continuing to work together, continuing to learn from each other, which of course is the reason for today. We're going to continue that learning and add to the learnings that I've just quickly summarized. I have to say that beyond learning amongst us, we also took the opportunity in terms of the co-sponsors and presented at different forums. We did present at CCAT in September 2011, that is the Organization of American States, Inter-American Drug Abuse Control Commission. We presented there. We presented at the Commission on Narcotic Drugs at the UN as well in 2012. There was a resolution on impaired on drugs and driving as well. So we have brought a lot of those learnings to other areas. And I have to say, we're going to continue that. Beyond today and beyond sharing what we learn and summarizing what we learn with you, the participants and the speakers, we will continue to share our learnings in other international areas and taking advantage of other international opportunities. So the objectives. The objectives of the next 2 days is really to take what we learned in Montreal and talk about how have we moved the yardstick. How have we moved a little bit further, and where is the evidence today? What progress have we made or not, and why not? We know that new challenges have been emerging and will continue to emerge, and the introduction of novel psychoactive substances, the whole issue of abuse and misuse of prescription drugs, and of course we've seen changes with respect to cannabis in different parts of the world. But again, despite the legal status of cannabis, we do know that it affects a person's ability to safely drive a motor vehicle, and therefore we need to address that as well. Regardless, our key areas of focus will remain what is the latest evidence and the experience related to law and policy, related to deterrence, detection, and enforcement, adjudication, treatment and prevention, and all of those aspects. And we'd like to look at what are the key practices of an effective drugs and driving program, and what are some of those key components. And that's something that the co-sponsors will be looking at in the next 2 days and trying to summarize what evidence is presented as it relates to those key components of the problem. I also wanted to mention a little tidbit of information. I don't know if you're aware that there's a growing international interest, and CCSA, for example, has been invited to a technical consultation group that is being organized by the World Health Organization next month to discuss policy responses to drug use and road safety, and we're very happy to see that. And by the way, a lot of our learnings going back to taking opportunities will be brought to that table as well. So let's make the best use of our time together, approach each topic in terms of what are those, what is the evidence, what are the core components of an effective program, because at the end of the 2 days, we'd like to walk away with maybe achieve some consensus on a path forward, achieve some sense of agreement on what are the key components of an effective drugs and driving program, perhaps develop a global guide for each of our countries, but globally, as to what are some of the things we need to be considering, what are some of the questions we need to be asking ourselves under each of those components. For example, I mentioned a couple. What is the purpose of the legislation? What is a drug that we are referring to when we talk about drugs? So again, I leave that with you because that's at the end of the session, at the end of the 2 days. We have about 2 hours to really reflect on that and achieve a consensus, a group consensus on a way forward and those key components that each of us can take back to our countries. I'd like to leave you with a quote that I really like, and it really speaks to CCSA at its core, and that is something from Henry Ford and to keep in mind throughout our meetings. He said, "Coming together is a beginning, keeping together is progress, working together is success." We have surpassed our beginning and we are making progress. I'd like to believe that since the first. Now let's work together to achieve collective success and create something that continues to guide action in area. And it's that creation of that something that I would like to leave with you. Again, thank you all for being here, and I look forward to our discussions. Thank you very much.